To describe anatomical landmarks, we sometimes use directionality, and some of those directionalities we'll discuss here, the first of which is superior, meaning towards the cranium or head. An example of which you can find in our heart blood flow video, where we discuss different aspects of the vena cava, one being the superior vena cava. Now, opposite of superior, we have inferior, and an example of this would be the inferior vena cava located below the superior vena cava. We will use medial to describe something that is midline or closer to midline of the body. And an example of this would be if we look at our ankle, the inside aspect of our ankle is the medial malleolus. Opposite of medial, we have lateral, meaning away from the midline. And an example of a lateral descriptor would be the lateral malleolus on the outside aspect of the ankle, the lateral malleolus. Further anatomical directional descriptors include anterior, anterior being the front aspect of the body, or ventral aspect, and posterior, meaning the back of the body. We also will use terms like proximal, meaning closer to the trunk or to the origin point that we're discussing. So the trunk would be best described here. And distal, which is opposite of proximal, meaning away from the trunk or away from the point of origin. So an example of this would be that our wrist is proximal to our elbow when we compare it to our first digit, which would be distal to the elbow. Other words that you might rarely see utilized to describe anatomical direction that are synonymous with what we've already gone over is sometimes you'll see superior referred to as cranial. Sometimes you'll see inferior referred to as caudal. And then, as we discussed previously, anterior, sometimes described as ventral, and posterior is sometimes described as dorsal.